Internews. And this is the 7th media dialogue by the Eastern and Southern Africa Interagency Working Group for Risk Communication and Community Engagement, also known as RCCE. Our topic today is school closings and COVID-19. There are so many issues to discuss for journalists when reporting the issue of school closures during a pandemic. Of course, we want to keep our children safe from this terrible virus, but we also need to know that closing schools has so many other detrimental effects for children, for parents, for entire communities. We will start our dialogue with three very good experts on this issue. We will hear from Dr. Deborah Barasa of the WHO, Mr. Abhiyan Jung Rana of Unicef, and Ida Jooste, who is the Global Health Media Advisor at Internews. All three of them will help us navigate through this very complex issue. My co-moderator today is Tole Nyata, who is Internews' pandemic mentor. We encourage you to write your questions for our speakers during the talks in the chat box, and Tole and I will raise them with the speakers during this session. I'd like to hand over now to Tole to say a few words and get us started. Tole?
Hello, folks, and thank you for joining. Let me tell you a bit about the RCCE group. It's an interagency group made up of, but not limited to, WHO, UNICEF, Internews, BBC Media Action. We have organizations like Save the Children. Now, these agencies usually go down and get feedback from the ground across the region, and it is this feedback that we'll be giving you at the end of this media dialogue as a poll for you to choose our next conversation. So thank you very much, and I hope you enjoy.
Thanks, Tole. Now, without further ado, I would like to call on Dr. Deborah Barasa. Dr. Barasa is a physician, and she's an infection prevention and control expert with the World Health Organization. She has more than 10 years experience running a successful HIV program and also experience in referral hospitals. Deborah, welcome, and the floor is yours.
Thank you very much, Wayne. So I'll go ahead and share my screen. I hope we can all see. So thank you, colleagues, for joining us in this media dialogue. And our area of focus today is COVID and school reopening. So on behalf of WHO, I present COVID-19 in children and adolescents, WHO recommendations so far on school safety during COVID-19 pandemic. So this is my presentation outline. We'll be looking at COVID-19 situation in Africa, COVID-19 and children, the WHO guidance, how to protect ourselves and others, and how to stay safe in schools. So as of 29th of January, we had more than 2.5 million cumulative cases in Africa, with over 2.1 million recoveries, and deaths were over 61,000. On the right, we see the age distribution, and what really we can see is that infections were high, highlighted in yellow, among the age group 25 to 64 years. However, infections are very low from the ages of 0.4, that is highlighted in blue, and then followed by 5 to 14, that's highlighted in orange. What's highlighted in gray is slightly high between the ages of 15 to 24. So indeed, infections in children is low compared to that in adults. So what do we know about COVID-19 and children? COVID-19 is reported much less frequently in children than in adults. And children and adults really represent 8% of the global reported COVID cases, yet they make up 29% of that population. Children do have milder or less severe disease than adults. All the same, children with underlying conditions, we need to remember, are at higher risk of serious illnesses. Rarely a few do develop severe disease, and even fewer have succumbed to the illness. So the role of children in transmission is not yet fully understood. Children of all ages can be infected and spread the virus, but studies today show that there's less spread among children under 10 years than in older children. So infection occurs more often in older than in younger children. COVID susceptibility or vulnerability rises with age. So this is a graph that's looking into COVID trends in Kenya following school reopening and lifting up of COVID restriction measures. On my x-axis is the time period, and on the y-axis is the number of cases. So you can see highlighted in blue is the cases aged between 5 to 9 years. And we see that the infection in this age is quite low. Also highlighted in orange are infections for the ages 10 to 14. And we can see there's an overlap showing infections low in this age group. Infections start rising in the ages 15 to 19, highlighted in green, and further increase in the ages 20 to 24, that is highlighted in black. For infections, for the people who are above 25, as we said, the infections are high and are in the thousands, but that is not reflected in this graph. So what is highlighted in purple is the positivity rate, and we see really it is quite low in this population. When we look at what is highlighted in orange at week 41, this was following opening of the candidate school. The candidates had opened the schools, that's grade 4, class 8, and form 4. But also at this time, we had the lifting up of restriction measures, that is lockdown measures were lifted up. There were the curfew hours were also reduced, opening of businesses, among others. And this was actually followed up by a rise in infection. The infection gradually reduced, and we can see that week 1 of January, there was full reopening of schools and universities. And we have seen that infections have really slowed down from then. We still continue monitoring the infections in Kenya. So for transmission of SARS-CoV-2 in schools, there have been a few outbreaks reported in schools in the early 2020, and that is because most schools were closed, and really infection in children was acquired at home. More outbreaks were actually reported in secondary or high schools compared to primary schools, and this is really worldwide, it's across the globe. So studies suggest that children less than 10 years are less susceptible and less infectious than the older ones. With regards to school outbreaks, we see that transmission was more between staff to staff as compared to staff to students or student to students. And early modeling studies suggest that closing school reduced community transmission less as compared to social interventions such as physical distancing. The viral load studies suggest that children with symptoms do carry the virus in the nose, mouth, and throat as compared, just as adults do, but for a shorter period of time. So what are the implications of the school public health policy? COVID-19 appears to have less effect in children's health than for adults. And in contrast, school closure can adversely affect the child's health, education, and development. Children and schools are unlikely to be the main drivers of COVID transmission when community transmission is low. So closure of schools can be considered only if there is no other alternative. However, there's need to take precaution, as we have seen, for the secondary and high schoolers in the setting. So adult personnel may be at risk of acquiring and transmitting infection, as we've seen. And so we need to really protect the staff working in the school environment. Community transmission is reflected in the school setting. That means that we need to really strengthen our public health measures in the community so that we can protect the schools and prevent amplification of transmission. So as WHO, we encourage a risk-based approach to minimizing the risk to students and staff. We need to understand the local context. what is the intensity of community spread and what is the local epidemic. With high community transmission, then there is increased amplification of disease and transmission to children can occur. We need to gauge the public health capacity to quickly detect and manage new cases or outbreaks. And there's need to evaluate school readiness and resources to maintain COVID prevention measures in schools, as well as consider deploying remote learning methods. We need to be aware of potential harm that may occur with school closure, such as disruption in health and social services, like meals and vaccinations. And we need to consider the benefits versus the risks across health, education, and socioeconomic factors when considering whether to reduce in-person education. So how do we protect ourselves and others? We need to encourage that in the school setting, we need the staff or the students need to stay at home and self-isolate when they are sick or unwell, or even if they have mild symptoms. We need to encourage cleaning of hands frequently with soap and water, or utilization of alcohol-based hand rubs. It's important that you encourage covering your nose and mouth with a disposable tissue or a flexed elbow when you're coughing or sneezing, and avoid touching your eyes, nose, and mouth, and maintaining a physical distance of at least 1 meter from others. We should encourage also that the students or the staff stay away from crowds, and the utilization of age-appropriate masks is also recommended. The use of medical and surgical masks for the high-risk groups, depending on the age and the medical conditions, is also encouraged. And regularly cleaning and disinfecting surfaces, especially the frequently touched areas, is also encouraged. So safety in school would include hygiene and daily practices at school, as we said, physical distancing, correct and consistent use of age-appropriate masks, and ventilation to ensure free flow of air, as well as cleaning and disinfection, prompt care for students and staff who feel unwell, case investigation, and contact tracing at schools. So these are my resources. Thank you very much.
Thank you, Deborah. I'll just remind the journalists in attendance here that we are welcoming your questions, and please put them in the chat box. And Tole and I will be monitoring the chat box, so don't worry, your questions will not be missed. And we know that we're dealing with so many different countries here, and the situation involving school closure and opening decisions varies very much from country to country. So we'd also love to hear what the situation is in the country that you're working in. I guess I do see a question there. I'm going to put it to Deborah. What is the appropriate age for children to be wearing a mask? And please unmute, Deborah.
Okay, thank you very much for that question. So what WHO recommends is the ages below 5 years, we don't recommend wearing of masks because of concerns such as the development and cognitive effects. For the ages 5 to 11 years, then this is based on a risk-based approach, and those above 11 years, then we recommend the utilization of masks. So for the schools, we are saying that some are, depending on the transmission, as we talked about the risk-based approach, what is the intensity of disease, among other factors, then we can consider utilizing of masks from the ages 5 to 11.
Okay, I see there are a lot of questions coming in. I think what we'll do now is we will ask our next speaker to speak, and then we will have questions for both speakers. So now I'd like to pass the microphone to Mr. Abhiyan Jung Rana. Abhiyan is UNICEF's Regional Education Advisor for Eastern and Southern Africa. He is based in Nairobi, and he's responsible for supporting UNICEF's education programs in the 21 countries in the region. So he's here to share with us UNICEF's position on school closures and openings during the pandemic. Mr. Jung, welcome, and the floor is yours.
Thank you very much, Wayne, and thank you, Deborah, for that lovely presentation. And good afternoon, good morning, all the participants. I see there are 60 now, which is really amazing. Good. So with that, let me just share my screen. And I am not allowed to share the screen for some reason. Maybe Christoph, if you can share your screen, because I don't have access to sharing screen. Maybe you can put up my presentation if you don't mind. And if you can start the presentation, that would be great. Thank you very much. I apologize for the technical glitch. I was supposed to present my own presentation, but here goes anyway. So like Wayne was saying, I'm the regional education advisor for UNICEF in this region and support the 21 countries education programs, including now how we respond to COVID-19 in these 21 countries and make sure that children are well looked after, especially the school-going age children. Can you go to the next slide, please? So just to give you a snapshot of what is happening, well, first globally, and then maybe going down to the region. So on the left, you can see a few numbers. As you recall, in 2020, February, March, when the pandemic hit, there was a roller coaster effect in terms of all countries immediately closing all their schools. This led to almost 1.6 billion children globally that were not accessing schools suddenly. So we have this big, huge number of children that were at home. With a lot of effort from all stakeholders and well-wishers, we really had a push towards countries reopening or safely reopening schools. And we made good stride towards getting children back into school again. Towards the end of 2020, there were still about 0.5 billion or 500 million children that were still out of school globally. But then as we got into January, because of some spikes in places and the new variant of the virus, the numbers started going up again. Schools started closing, countries started closing schools, and we were almost hitting the 1 billion mark again. So, and then at the same time, I just want to give you a glimpse of what has been happening in our region. So like Wayne said a while ago, we have 21 countries in the region, going all the way up from Eritrea all the way down to South Africa. So the color coding in the map, if you can see, the dark blue ones are countries that have fully reopened school and are still fully reopened. The light blue ones are where they're partially reopened, where staggered approaches or test-taking grades are back in school. And then the red ones are the ones that are fully closed again. And this color coding was very different towards the end of last year, where a lot more countries were in dark blue, meaning most of them were fully reopening schools. But like I said, the trend has been turning around. In our region, before the pandemic started, there were already 37 million children of school-going age that were not in school. That's a huge, huge number. And then now, as of January, there are still about 46 million children. Looking at the light blue and the red colored maps, 46 million children that have not come back to school, which means if you add both the numbers, you're getting around 80 plus million children in our region alone that are not in school. And this is a really, really critical and huge number that is going to become a big, big issue as we move along in 2021, and somehow trying to get all these children back into school is going to be our big big challenge. Next slide, please. Christoph, can we go to the next slide? Yes, thank you. So here, I'm just trying to give you some sort of a timeline that countries have taken up in terms of fully school closure to partially reopening and to fully reopening. So as you can see, the red ones, countries on the left that had fully closed schools, and as you get into light blue, partially opening and fully opening. So the red ones, and you can see Burundi, for instance, the second one, which never closed school in our region and have always kept all schools open. But most of the countries fully closed, and as time went by, May, June, July, slowly countries started partially reopening and then jumping into fully reopening around September, October. And then by, say, November, December, you can see that all countries were either partially open or fully open, which was great. And we had a lot of children back in school, and we were trying to get the rest into school. But then, as you can see, in January and getting into February, there are countries, because of the spikes, because of the new variant, because of fear, countries have started closing schools again. And you can see, especially these ones that are in Southern Africa, like Eswatini, for instance, or Lesotho, because of the new variant in South Africa, and of course, South Africa also. So this is the situation. We had fully reopening almost all countries, and then now we're getting back into closing schools, and hence the really, really critical point of making sure that we advocate and make sure that we reopen schools safely and as soon as possible. So let me move on to the next slide and give you a few things on why it is so bad for children when we close schools and close schools for a long time. So what are the big disastrous impacts? So first of all, children are losing their learning. Just to let you know, in sub-Saharan Africa, what we call learning poverty, about 78% of children aged 10 could not read a simple line or write or understand a simple line, which means they were learning poor. Now, with these long closures of schools, this is going to be really exacerbated, and children will not be learning the competencies that they need to know by their age group. As also, there was a big push on remote learning when all schools closed. And we, being in the context we are in Eastern and Southern Africa, with very low internet connectivity, lack of electricity, lack of gadgets, remote learning was not so successful. Despite all of that, with radios, with TV, we did try to reach out to as many children as possible, but to keep that going on a sustained manner was difficult. And as you can see on the chart on the right, the one in the middle, which basically shows the interest and participation of children by weeks in terms of remote learning. And this is an example from Côte d'Ivoire, from West Africa. But it basically shows how quickly interest wanes in remote learning. And of course, the World Bank has also estimated that with 5 months of school closure, it can lead to about $16,000 or 0.6 years of schooling over a student's life. So that's a huge, huge loss. Second, permanent school dropout, especially for the most marginalized, the poorest, the remotest part, where children live in the remotest part. Girls, especially adolescent girls, are not going to come back to school if we keep schools closed for too long. And we've seen this from the Ebola crisis in West Africa, where, for instance, in Sierra Leone, almost 20% of the children never came back even after school opened. So we really need to make a big, big effort and push in trying to bring everybody back into school. And we can only do that if schools reopen. Loss of protection. Children are at a lot of risk if they are, confined in their homes for long periods of time, because schools can be protective areas. We've seen increases in teenage pregnancies, teenage marriage, gender-based violence, just violence and abuse at home. So this increases the risk for children if we keep the schools closed for too long. There is already school-based services that is happening in schools, and children are missing out on that. Things like immunization, school meals for, there were 16 million children that were getting daily meals in our region, which they are not getting anymore because schools are closed. And for some of these children, these meals was the only nutritious meal that they got in the day. So we are keeping a lot away from these children because of that. And of course, there's social interaction, meeting with their peers. They're missing out on all of that. Somebody had also raised an issue about mental health and well-being. Parents are full of stress. There's economic pressure. There's a lack of future opportunities. Children are growing up in that tense environment, and it is affecting them. And keeping schools closed, keeping them away from the social interaction is going to be affecting them. And then on the longer term effects on life expectancy, there's been research done or projections done in the US saying if schools are closed, children lack education, lack employment, lack finances to have proper medical services, et cetera, and learning bad habits, all of this can lead to losing years of life. And they have, you can read the research that was done in the US, and it will be relevant for us as well. And the links are given in the presentation for you to have a check. Okay, now moving on to what do we recommend? Can we go to the next slide, Christoph? And this is going to be the last slide. Oh, one more, yeah, thank you. So what is our recommendation in safe and inclusive return to learning? So first of all, I would say wherever there's a lockdown or you're moving towards a lockdown, there's an issue in needing to close social gatherings. Schools should be the last ones to close, and when we reach safer ground, they should be the first to open. So, instead of focusing on opening bars or restaurants or places of worship or whatever it is, I think we should prioritize schools as places that should open first and close last. Because as mentioned by our colleague from WHO, Deborah, schools are not the main driver of the pandemic. Children are not the biggest transmitters of the diseases. So that is one. Second, we've seen many national school closures, and we should avoid that. There could be spikes in places, in regions within a country, and I think we should look at them separately and not do a blanket order and close all schools. So looking at exactly where the issues are arising, we should focus on those. Third, we should really safely reopen schools. So including everything Deborah talked about, and you can see there's a framework for reopening schools. There are many guidelines, there are many checklists that have been developed by various partners who work in this area to employ and make sure that schools are safe when they are reopening. So looking at hand washing, masks, physical separation, ventilation, bubbling, as in keeping small groups of children together in schools, staggering meal time to play time, all of those things can be employed. And then of course, we need to protect the children and teachers that are at risk with pre-existing conditions, old age. I think we need to pay special attention to them. Removing the barriers to returning to school, and I mentioned a few before, but things like economic barriers, paying fees, we should cancel all of that. Things like trying to get uniform for kids, maybe taking that away, social norms, fear, trying to remove all those barriers so that children can get back into school. And then finally, I think we should disseminate this widely and tell communities, learners, parents to adopt behaviors of certain ways when you detect some virus in the school. So there are many guidelines that are there on how to address when you see some cases in schools, how you can separate a certain bubble of children away from and observe them until you can bring them back. So there are many things, and I think we need to advocate and share that widely to all the people that are concerned with bringing children back into school. Thank you. So with that, let me just stop here. I have not been paying attention to the chat box, so please, if there are any questions, I'd be more than happy to answer.
Thank you very much, Abhiyan. Yes, there are some questions. I'm going to cluster these ones. There's one from Peter Manut, who says some countries in Africa, especially in Southern Sudan, there are very few face masks. What is the preparation from UNICEF, WHO to ensure that schools reopen safely? And a similar question from Collins, a journalist working for RFM in Kenya. He says schools in Kenya have reopened, but parents and children don't feel safe. What is WHO and UNICEF doing to assure schools are safe? Thank you.
Sure, thanks. If I heard it correctly, it was the first one was regarding South Sudan, and of course, that's right? Yeah. So yeah, of course, you know, the situation in South Sudan is very, very different from, say, southern part of Africa, and we are working very, very closely with the Ministries of Health and the Ministry of Education in trying to make sure that all schools are open safely, including provision of supplies, especially around masks, around water sanitation, you know, bringing water and sanitation equipment, things like that to the school as much as possible. And not only us, but all the stakeholders in the area of education that are trying to bring back all these children back into school and open them. We're working very closely with the government. That is our main counterpart in any country. And we work very closely with them in trying to see how quickly the schools can meet the minimum standards to be safely opened. Yeah, so that's basically what we're doing. I think the issue around parents don't feel and children not feeling safe in Kenya, what I would like to say, and I think, you know, our colleague Deborah has mentioned this many times about how this virus affects children much less than older people. But what we've also looked at, and I think she's also shown it, the trend of spikes of the pandemic in Kenya and the timeline in terms of opening and closing schools. And it does not seem to correlate. When you open school does not mean the spike happens, and when you close school, the spike goes down. We've seen it even differently where schools have opened and the spikes have actually gone down. So you know, there are many research, many you know, documents around, evidences around from globally, from Africa, that shows why it is safer for children to be in school rather than in communities. And if you walk out and see where the children are right now, if schools are closed, they're not sitting in their homes and isolating them. They're mingling around in the communities, they're meeting people and have even more chances of acquiring the virus. But you know, I would let Deborah supplement if you feel I have missed out on something, Deborah, on this question.
Yeah, thank you very much, Abhiyan. I think you've said pretty much what my thoughts are, that indeed the school setting is quite safe for the children. But then let us remember that when there's high community transmission, and the children are mingling with the community, they are likely to get the infection. So it's important really to ensure that our schools are safe, and we look into the infection prevention control measures or the public health measures, surveillance, improving our surveillance so that we can have our children safe as they return back to school. Yes.
Thank you, Dr. Barasa. There are quite a number of questions for you. Would you like to take a batch, like say 2 or 3? What works for you?
Yeah, 2 or 3 is okay with me.
Okay, awesome. So first question from Halima Abdile, who says after school reopening, the graph was down in terms of contracting. Do you think school closure was a wrong idea? And the second one comes from Kim Harrisburg and says, my question to Deborah is whether there has been any research on mental health impacts of school closures on children compounded by the digital divide.
Okay.
Okay. Go on.
Yes. Thank you very much. I think with regards to the drop following the school closure. You were asking that. I can't remember, what was it again, Tole? Following the school closure, that there was a drop?
There was a drop in people contracting COVID-19. So was school closure a wrong idea?
Well, I think as evidence unveils, as we learn more about the pandemic, then we can really give a confident response to that. But what we are seeing so far is that children are not transmitters. They only represent 8% of the cases, and yet they are 28% of the global population. So indeed, they are not transmitters, especially the under 10-year-olds. Yes, thank you.
And is there research which has been done with regards to mental health impacts of school closures on children?
Yes, I think there's a lot of research that has been done, and I think that is a question that Abhiyan should be confident enough to answer in view of UNICEF following up schools and the mental health impact, and I believe he has alluded to that answer. Yes, so there is some research that has been done on mental health, and indeed there's a lot of impact, including issues of anxiety and depression, among others. And although, yes, we need to have more research in this area, and we are really following up to conduct such studies in our African region. Yes.
Tole, if I may add, I think Deborah has answered the question. It is impacting children, right? Because they're missing out on their social interaction. There's a lot of pressure at home. Their parents are agitated. You know, the environment is such that it has to have that effect. And like Deborah was saying, there is research being done, but despite that, we're already looking into how can we address this issue. So addressing teacher training and including how to identify mentally affected children, what kind of counseling can be given to them. All of that is included in some sort of a response to the COVID in reopening schools. So also as a preparation for reopening schools, we do support teacher training where these things are included in their training.
Thank you. Another question before we go to Ida, to Dr. Barasa. It says, would you say that in a community where community transmission is rising, it would be advisable to close schools?
That is a very good question. And indeed, it's a question that we have been having discussions with from our WHO level. And really, the response is mixed. I will not give a concrete answer. The response is mixed, and it's a balance. It's a risk-based approach. It's a balance. So we talked about the risk-based approach. We are looking at the intensity of infection. If the infections is high, we are not lying. There are risks that the child can become infected with COVID. However, we need to look at the benefits and risks. Let us look at the risks of school closures. We talked about the effects on mental health in children, the violence that comes with it, and the deterioration in the education, among others. So it is a balance. And so that is one of the things that needs to be discussed at a local level with consultation.
Thank you.
Well, I just recall something, about the mental health issue. There was a research done, or at least I've seen one that is actually showing in China. It comes from China. 30% of the children went into depression because of this whole pandemic and needing to stay away from schools. But as you know, China was one of the countries, well, it started there, but one of the countries that was initially really forward in reopening and bringing children back into school.
Okay, thank you. Wayne?
Thanks, Tole. Yeah, this is such a dense, multifaceted issue we're dealing with today. And so we're very fortunate to be joined by Ida Jooste. She is Internews Global Health Media Advisor. She's based in South Africa, and she's now going to share her thoughts on what journalists should keep in mind when approaching this subject. So I'm going to hand it over to you, Ida.
Thanks, Wayne, and thank you so much to the panelists and all colleagues for this really important discussion. One of the last statements made by Dr. Barasa that
I can't hear her.
About you can't hear me?
Yeah, Ida, you're breaking
Oh
up.
dear.
Some
Let
breakup.
me quickly. I hope this is a better connection.
Much better.
Do you hear
Much
me
better.
better now?
Yes.
Yes.
Wonderful, better connection, technology. Let me, because I just felt it was so important what Dr. Barasa mentioned in her final statements, that it is a question of balance. It's a principle, balance is a principle which we as journalists hold really dearly. I want to say this discussion is just incredibly important because of the fantastic data and insights that have been shared here today. So first of all, we're privileged as journalists to actually have this kind of data, this robust data, this guidance coming from both the WHO and Unicef, the most credible sources you could possibly have on the issue of schools and reopening. And yet at the same time, we can't help feeling a bit of a dilemma within ourselves as journalists for a number of reasons. The reasons are, for instance, as we saw from the red, blue, and light blue map, that in some cases, governments have felt differently. So if we live in a country where our governments have felt that the schools should be closed, it's a dilemma, because how do we report on that? Another reason is that individuals closely attached to the school may feel differently. Those could be individual teachers, they could even be teachers, trade unions, teachers unions, as we have, for instance, in South Africa. SATU is the teachers union, which does not want to have schools reopened. Parents could feel differently. So immediately it's a dilemma for us reporting on the story. And the other dilemma that came from both the presentations, especially from what Dr. Barasa shared with us, are those areas where we understand that in science, as Dr. Barasa put it so clearly, some of the factors are not yet fully understood. I took note of it when she said that, because that is a phrase that we're hearing very often in COVID times, and we must respect that phrase, and we must respect the humility that comes from scientists and experts like Dr. Barasa and Dr. Abhiyan when they say some elements are not yet clearly understood. We also know that there have been a few outbreaks at schools, and we also know that there are indeed adults at schools, that group which is at much higher risk, as has been explained, at schools. So those are dilemmas that come to our mind as journalists, that on the one hand, we hear the clear evidence about how beneficial it is, how much more beneficial it is for all of the long-term reasons for schools to reopen. And at the same time, we feel these dilemmas which may come from our own heads, from our own perceptions, or indeed from parents or teachers in our various areas. So this really makes me think very much of these wicked problems that have come into our lives with COVID-19, that there is a problem, but the mitigation to the problem or the solution to the problem, I mean, the problem is the virus, is the fact that if people are getting ill, etc., that people are feeling unsafe, that some people aren't acting according to best practice. Those are problems. But the mitigation to the problem is not necessarily a perfect solution. So this is an area of nuance in storytelling. So what I thought to do, I've come up with a tip sheet just for you to take home. There may not be enough time to go through all of this today, but just to say, I mean, as a journalist, reporting on a dilemma, reporting on this area of serious public interest and concern, when we think of balance, it's not necessarily a 50-50 balance. I think the data tells us it's a different kind of balance. The data and the evidence is clear, but we do want to be journalists who listen deeply to our communities where we report. When there are concerns, we have to show that we're listening. When there is some evidence that's not yet completely understood, or when there should be an outbreak at a certain school, we also need to be responsive to those realities. So I think Christoph will post in the chat the tip sheet that I've put together. And what I've done there is to simply put up a few scenarios. What do we do when the data, so we know that the data presented is compelling, but what do we do when the schools are still closed? How would we handle that story? Make sure, of course, that storytelling is mainly about getting the right sources to tell us the right thing, right? We must be sure that we know what the procedure is in our country for this position being changed, for the policy possibly changing. We also know that what has been suggested by our two speakers is that sometimes those national policies don't make as much sense as simply going much more to a local and district level. And immediately, of course, it presents yet more dilemmas. It means that some districts or provinces, or however your country is structured, must make those decisions. It's always more difficult for individual decision makers when the responsibility is with them. Do they know what the data is? Do they know where to listen? Do they know where to look in order to make those decisions? And sometimes, of course, it may happen that there is an outbreak at a school amongst teachers, for example, and that would be quite a tough story to handle. So I've just given a few tips over there. And then, the other tips really have to do with general principles in journalism as well. For us to be that voice and watchdog in the community, we must know the schools on our watch, because as a watchdog journalist, we have schools on our watch, the schools we report on, so that we're a trusted source of information. Check that we know how to contact the school, who's the decision maker on the school, that we can tell stories about how it's going in that particular school. Stories about trends, shifts in trends are always very, very meaningful. For instance, if a school didn't have water, but it has now found a solution to have water so that it could be safe hand washing, that's a good and great positive story to tell. Our contacts are the most important thing. And then I thought, when we have a wicked problem, when we have something where we feel an internal dilemma, there's simply, sometimes it's just really, really refreshing to report on those instances where it has gone well. I would like to ask, maybe we can stay on the tips and after that go to some pictures. But of course, the point is to continue to highlight best practice. We know about physical distancing. We know about mask wearing. We heard some additional guidance about masks. And, also sometimes our role as journalists is to explain to people why the hand washing. It's because as humans, we like to touch our face, we put our finger in our mouth, we wipe our eyes, etc. And that's why we need to wash our hands, so that whatever may be on surfaces and around us doesn't enter into the cells of our body. So basically, all of the general COVID safety principles obviously apply completely to schools, but in a special way. We do need to be concerned about adults in the school system. And then lastly, I would say that the ideas we saw from the map that Dr. Abhiyan showed us, and we also know from our own instincts as journalists, it always makes sense to make comparisons, to compare ourselves to a neighboring country, to compare ourselves to maybe to different areas in our own country, and also to make global comparisons. All of those contacts will help us tell this complex, nuanced, but very, very important school story. I wanted to actually highlight two of the questions from the chat, what Justin and Deborah said about water. Those are the real concerns. That is where we are watchdogs as journalists. When schools do not have water, how do we keep on following up to ensure that that school realizes that we're not going to let go until that element of school going is safe, etc. I know sometimes the solution is not easy because they're not far from a source of water. So Christoph, can you just show us some of those pictures that I've put together where, for instance, physical distancing, we know can be a problem at some schools, but some schools have been, so here is a sanitation solution that a school has brought. Highlight them. Let people see, let schools emulate what works well. And in the next picture, which I find really, really inspiring, is a wonderful picture from Soweto in South Africa. And I've also seen similar pictures from Kenya, where this has been the solution. We all know why it makes sense. We know about ventilation and the distancing. And in many cases, when there's no rain, this is just simply much better than congregating inside. You also see that the teacher is not in touch with other adults, which is another thing we can advocate for in our stories. And then there's another picture. We know that amongst adults, amongst NGOs, amongst people who need to gather frequently for their work, this has also been introduced as a solution. Why not at more schools? And we can actually find schools and promote those practices. The last point I had made was about comparison. So we can just go to the final picture and to say that we have the WHO guidance, the Unicef guidance, highly relevant for the story. And as journalists, we also sometimes we always want to have something unique about our stories. So nurture those excellent commentators and contacts, either from your context, from your town or for your country where you live, but also from an international perspective. For instance, in the last slide I have here, Professor Francois Balou is a brilliant virologist and epidemiologist, and he has promoted a tweet by this person, which actually which talks about this study, which confirms everything that our two experts have told us today. So sometimes we just want to have a new and different voice. Look for them online, find those credible sources to continue to tell this school story in a compelling way. Thanks, I'll leave it at that.
Thank you, Ida. And we have quite a number of questions. So what I'd like to do is to ask the questions, but before we get the answers, I'd like Christophe to launch the poll that I talked about earlier. This poll will help us choose the next topic for the dialogue. So before the poll, here are the questions that the panelists should prepare for when they come back. There's a question from Peter Manut. And Peter Manut says, what advice does WHO and UNICEF should give to schools before they get reopened? And then a question from Henix from Kenya. It says, any of you can respond to this. Any links with the high indiscipline cases in Kenyan schools days after coming back from the COVID-19 break? Is there any links to what you're saying to this indiscipline? And then Kim Harrisberg asks, how can remote learning be made more sustainable? So those are the questions to the panelists after we come back from the poll.
Can I start, Tole?
No, just give me one more minute for the poll to answer.
Yeah.
Sorry about that. Well, we are that. We have quite a number of comments from colleagues. I've noticed colleagues from Uganda saying the situation. There is, if I can read, colleagues from Uganda saying, in Uganda, public school reopening is likely to face challenges because of class size, basically. And this is Mulimi, a science journalist with the Nation Media Group in Uganda. He's saying she prefers if children go back to school to learn. And there's also somebody else who's concurring with Irene, is saying school-going children have faced a lot of challenges during this long break. Many girls have gotten pregnant and married and since cannot resume school anymore. And many boys have turned to using drugs, thefts, etc. And still the government of, and Uganda still says it cannot fully reopen schools. So the colleagues are basically reiterating what was being presented. And most of these are comments, and the ones that have raised the questions. I think we are good to go. Christophe, if you end the poll and we continue, thank you. Dr. Abhiyan,
Oh, sorry. You know, my screen was showing your internet is unstable. Maybe that's why I didn't hear the last part. I hope you can hear me. Let me just start off by really admiring and complimenting what Ida put on the table. I think it's so critical how the media is going to play a part in bringing all our children back into school, into open, safe schools. And the photos she showed, those can be so powerful to move the politicians to make the right decisions to have our children back in school. I think it's a great thing, a great partner. But for that, I think the media itself needs to become knowledgeable about the pros and cons and what are the safety measures that are required for actually having schools open. So I think amazing. I really thank you, Ida, for putting all of that on the table. Thank you very much. You also mentioned something about countries in the region following actions taken by other countries. And we saw that when the first schools closed in one country, it was a domino effect and all countries started closing schools. And once countries started opening, and country like Kenya or Uganda or Ethiopia, you know, these are countries that others look towards and then take actions as well, and then started reopening schools. So I think we need, and now with some of the Southern African countries closing, you know, I hate to think that it could have a ripple effect going northward and having more countries closing schools. So we need to keep advocating the impact, the negative impact that children are facing as they are out of school. And you mentioned so many of them, Tole, in the comments about drugs, about pregnancies and learning loss and all of the things that I presented as well. So I think we should keep all of that in our mind. There was a question around advice to schools. What advice could you give to schools? I mean, first and foremost is that the school should be linked up very closely with the community, and together working with the community and the school system and the health system, safely reopening schools. I think that is going to be paramount responsibilities of all the schools. Schools should also prioritize the most disadvantaged, the young girls that come from poor, remote background, because they will be the ones to suffer the most. And I think we need to keep them in the forefront of our thinking, especially the schools, in terms of how they respond to these kids. And of course, like I mentioned earlier, we need to make sure that schools are also protecting the children and the teacher, the ones that have predisposed or pre-existing conditions, age, whatever it could be, to protect them. Let me stop there. Maybe Deborah can answer a couple more while I have a sip of water.
Sorry. Yes, Dr. Deborah.
Oh, thank you very much, Tole. So I think I totally agree with what Abhiyan has said, as well as what Ida had talked about. So maybe just an addition, I think we will be sharing the guidance documents by UNICEF, WHO, CDC, and other partners that are looking into the various issues or the guidance, the advice that we are giving countries as the schools reopen. So these include, yes.
Go on. Sorry.
Yeah, so that includes the public health and social measures and the risk-based approach, the surveillance, communication, among others. Yes, thank you.
There was a question by Henix about the indiscipline we are currently seeing in Kenyan schools. Can we relate that to the school closures?
Yes, indeed, it may be associated with that based on the correlation. And probably we need to really look into the issue and let the mental health and psychosocial team come in and evaluate further. But with the correlation, it may be related to that.
Thank you very much. Dr. Abhiyan, there was a question about how can we make remote learning more sustainable?
Yeah, I wanted to get to that. So I think because of the pandemic, I think remote learning, not only remote learning, but digital learning is going to be the next big thing on the horizon for education. I know the pandemic has been really bad for all of us, but it has created an opportunity for countries to start establishing how to reach children through remote learning, through digital learning. How do we connect all children, all schools? So there are many efforts underway in terms of trying to do that. For Unicef, a big agenda going forward is what we call reimagine education, which is trying to say that we need to connect all schools and connect all children through the schools to the internet. And I know there's many issues and everybody will have a knee-jerk reaction saying, we don't have electricity, we don't have internet, we don't have gadgets. Yes, that is true. And countries need to realize that they need to start addressing this issue, because if we don't, we are going to miss the train. The world is moving towards a connected world, a digital world. And if we don't bring these children onto that train, we are in Africa going to miss that train. So I think there's going to be a lot of push with all the countries, all the governments, from UNICEF side, from many of the actors that have come together on this in trying to connect schools to the internet. Try and see if we can create online content that can be easily accessible, trying to get cheap gadgets that are working in the hands of children that can access these things, bringing in the MNOs, the mobile network operators, to say how they can play a part in trying to connect these children to the internet and to education content. So trying to bring all of that together, we have embarked on, like I said, something called Reimagine Education, to work with governments and other stakeholders like big players, Google to Microsoft, and try to bring them together to see how we can support this connectivity and digital learning in the region as well.
Thank you very much. Before I take it back to Wayne, Ida, do you have any closing words? And then we move to Wayne, who will give us the results of the poll and wrap it up.
No, I think, only thing to emphasize is that obviously to just be in touch with schools, to actually get contacts and connections at individual schools, because that's where the stories will lie. But of course, as always, during COVID, a lot of us established new and fresh contacts with epidemiologists, virologists, etc., etc. The school story is so important that it's also important to get contacts in the field of education, the policymakers in each of our countries, and if it's a national or a devolved responsibility is different from country to country, but to actually know all of those, to be tuned into any news conferences that they may be holding, but actually most importantly to hold them accountable for clear communication, which you can only do, of course, if they know you, which is that contact building thing, which is so important in journalism. Thanks.
Thank you. Wayne.
Thank you. Thank you, Ida. Yes, I just wanted to mention that we will have a recording of this talk, and we have fact sheets and other resources that we will make available to all of the journalists participating in today's session. We held a poll to see what topic we should deal with next time. And here are some of the results that we got. At 13%, people wanted the topic health workers, how we persevere through the second wave, and what we want everyone to understand. At 10%, does COVID-19 exist? Facts about the virus causing COVID-19, its nature and evolution of new viruses or variants. At 37%, we have healthcare, testing, and treatment, how media can help address the issue of stigma and discrimination. But at 40%, which is leading, your questions answered facts about the COVID-19 vaccine. Of course, the vaccine is front and center in everybody's mind now, and it will play such an important role in school closings and openings as well. It's hard to address the subject of any pandemic subject without talking about the new vaccines and when they will arrive. So we will be taking all this into account, and we'll let you know about our next session. And we are, yes, very close to the end of time. So what I would like to do now is thank Dr. Barasa and Mr. Jung Rana for joining us, and Ida Jooste for joining us. Thank you to all the journalists who came on board today. We hope this session was useful, and we would love your feedback on what you think of our sessions so we can make improvements as we go along. And at this point, I will say thank you to Tole as well, and wish you all a very good day, and we'll see you again soon. So thanks everyone, and bye-bye.
Thank you, everybody. Thank you.